Zika virus infection in pregnant women in Rio de Janeiro. Introduction. Zika virus has been linked to central nervous system malformations in fetuses. To characterize the spectrum of the Zika virus disease in pregnant women and infants, we followed patients in Rio de Janeiro to describe clinical manifestations in mother and repercussions of acute Zika virus infection in infants. Diagnosis. The diagnosis of Zika virus infection in Brazil relies on identification of the virus through RT-PCR during the acute period of infection. The virus is detectable in blood during the period of acute viremia and initial symptoms and subsequently in the urine, generally for 3 to 14 days, and succeed because RT-PCR assays for Zika virus are generally not available. Most cases of Zika virus infection in Brazil are diagnosed clinically without laboratory confirmation. Complications. Complications of Zika can be described, especially if a woman contracts the virus while she is pregnant. It can cause a range of effects known as a microcephaly, the unborn child. The brain and head of the newborn will be smaller in size than the usual. Loss of pregnancy, stillbirth, and other congenital disabilities are also more likely. During the recent outbreak in Brazil, there was a tenfold increase in newborns with microcephaly after October 2015 compared with previous years. There have also been reports of people developing Guillain-Barré syndrome following a Zika virus infection.
Zika virus is a flavivirus spread predominantly by Aedes mosquitoes. Acute infections can occur with mosquito bites or through sexual transmission, and can manifest with low-grade fever, rash, arthralgia, conjunctivitis, and headache. In pregnant women, acute Zika infection has been associated with fetal death and fetal brain defects, such as microcephaly, intracranial calcifications, and cerebral malformation, as well as ophthalmologic lesions. In a prospective cohort study, investigators enrolled 345 pregnant women at any period of gestation in Rio de Janeiro from September 2015 through May 2016, who had presented to clinic with rash that had developed within the previous 5 days. The investigators determined pregnancy and infant outcomes for the women with acute Zika infection. At the time of enrollment, blood and urine samples were tested for Zika virus. Patient specimens were also tested for viruses that can cause fever, rash, or congenital defects, such as dengue, chikungunya, parvovirus B19, and cytomegalovirus, as well as for syphilis and acute HIV infection. All study participants received regular weekly telephone follow-up, along with a second clinic visit within 30 days of enrollment, and serial fetal ultrasonography during the pregnancy. 182 of the 345 pregnant women, or 53%, tested positive for Zika virus by PCR in blood, urine, or both. The timing of acute Zika infection ranged from 6 to 39 weeks of gestation, with more than half of the infections occurring in the second trimester. The majority of women infected with Zika virus had pruritic rash, arthralgia, headache, and conjunctival symptoms. Over 25% had a low-grade fever. By the end of July 2016, a total of 186 pregnancies, 125 affected by Zika virus and 61 unaffected, had reached completion and were fully evaluated. 117 live births occurred in Zika virus-affected pregnancies, and 57 live births in unaffected pregnancies. The fetal mortality rate was 7% in both groups. 49 or 42% of the live births in the Zika virus-affected pregnancies had evidence of gross central nervous system abnormalities on clinical exam or brain imaging, as compared with 3 or 5% of the live births in the pregnancies unaffected by Zika virus. Microcephaly was observed in 4 infants whose mothers were infected with Zika virus in weeks 8, 12, 30, and 38 of gestation. In conclusion, acute Zika virus infection during pregnancy can have harmful fetal consequences, with over 40% of infants having evidence of abnormal CNS findings during the first months of life. Full research report findings are available at nejm.org.
Clinical presentation of the mothers. All pregnant women had rash as part of their clinical presentation. A descending macula of macropapular rash was the most common type of exanthem noted in Zika virus-positive women. The other prevalent finding was pruritus, which has been in 19% of Zika virus-positive women in our study. The next most common finding was arthralgia, which was reported in 62% and 17% of Zika-negative women. Conjunctival injection was present in 58% of Zika virus-positive women and in the smaller percentage of 14% of Zika virus-negative women.
Bem na época do meu irmão mesmo, agora que eu tava na porta, eu tava lá. Ó, aqui, tá legal. Já pode usar, porque foi ensaio. Eu soube do Zika vírus, eu devia estar com uns 3, 4 meses de gravidez. Então eu fiquei bem apreensiva, tive bastante medo no início, principalmente porque nessa fase o risco da microcefalia, né, que está ligado ao bebê, né, contrair microcefalia que está ligado ao Zika é um pouco maior. Então começou a passar bastante na televisão e a gente buscando muitas informações. No início um pouco com medo até de sair de casa, porque a gente não sabia o que estava acontecendo e como que isso poderia ser transmitido, né? Aí o médico passou as orientações pra gente, fez algumas restrições por conta do próprio Zika, né? E aí eu fui ficando um pouco mais tranquila, mas no início eu fiquei com bastante medo. Talvez, se eu soubesse antes, eu teria esperado um pouco mais para engravidar, porque a gente tem ouvido casos, né?
Conclusions. Despite mild child symptoms in the mother with Zika virus infection during pregnancy is deleterious to the fetus and is associated with fetal death, fetal growth restriction, and a spectrum of central nervous system abnormalities. Founded by Ministério da Saúde do Brasil and others, was found as information.
Hello, I am Dr. Yogendra Jhala from Mayflower Women's Hospital, Ahmedabad. I am a consultant obstetrician and gynecologist, and today I would like to discuss with you about the Zika virus infection during pregnancy and what care should be taken by pregnant women. I am sure most of you would be aware that Zika is a member of the virus family and is mainly spread by Aedes aegypti mosquitoes. It is the same virus which also causes dengue fever, which you all are very familiar with. Now these mosquitoes are most active during the daytime, and hence you are required to take precautions during the daytime as well. The infection known as Zika fever or Zika virus disease often causes no or only mild symptoms, similar to a very mild form of dengue fever. The disease can cause fever, skin rashes, joint pains, and sometimes conjunctivitis. However, the vast majority have no symptoms at all. The symptoms can appear anywhere from 3 to 14 days after a bite from an infected mosquito, and they can last from several days to about a week. If you're not pregnant, you don't really have to worry too much, but during pregnancy, it can have devastating consequences. Zika virus infection can cause microcephaly, which means smaller brain and smaller head in babies. Often it causes severe brain damage and it can result in miscarriage or even stillbirth. However, you must also know that Zika virus is not the only reason of microcephaly. It can also be caused by other infections like German measles, also known as rubella, toxoplasmosis, and cytomegalovirus infection. Not all babies born with congenital Zika infection will have all of these problems. Some infants with congenital Zika virus infection do not have microcephaly at birth, but later on they may experience slow head growth and develop microcephaly after the birth. Pregnant women who have Zika symptoms at any point during their pregnancy should be tested for Zika, and diagnosis is done by testing the blood. There is no specific vaccine or specific treatment available as yet for the Zika virus. Infected people are therefore advised to take plenty of rest, drink plenty of fluids to prevent dehydration, and take paracetamol if they have fever or pain. Aspirin or similar non-steroidal anti-inflammatory drugs should be strictly avoided until dengue infection is completely ruled out, and that is to prevent or reduce the risk of bleeding. It is good to know that admission to a hospital is rarely necessary. What precautions can you take to prevent Zika? Pregnant women should consider avoiding travel to Zika-affected regions and countries. And you should take precautions to decrease mosquito bites in areas where the disease occurs. Use insect repellent creams, cover much of the body with clothing, use mosquito nets, and get rid of any still water where mosquitoes are likely to reproduce. Okay, I hope you found this information helpful. If you still have any further doubts or queries, I suggest you should go and see your doctor. Thank you for listening.